sometimes they have to subscribe for like insulin and tablets. So in rural India, basically most of the houses do not have fridges so to store insulin. So
Ah.
accordingly, the healthcare is challenging there. Coming to the urban setup, like since the people are well to do and they have money to expend, so here the primary care like includes not only the doctor but dietitian and the exercise consultant are also added to the healthcare of the lifestyle diseases or these type of diseases.
Hi, I'm Helena. I'm part of the team Merakoi, and welcome to our latest Merakoi Voices podcast. If you manage diabetes drugs, the chances are that your next million users will live in India, but I bet you've never heard from one of them. Their stories rarely reach our inbox. Today, you'll meet Deepak, who has lived with type 2 diabetes for a number of years. He was diagnosed in a rural community and has since moved across India to various urban cities. He will share his very personal experience of being diagnosed with type 2 diabetes and living in various communities across India. It's a story that you won't have heard before, so please listen on. Hi, I am here with Deepak Shukla, who is a person living with type 2 diabetes in India. So welcome, Deepak. Thanks for joining us. Can you introduce yourself very quickly, please?
Yeah, thank you, Team Meraki, for inviting me. So, like I am from India and I live in Delhi, India, and I basically belongs from Ranchi, Jharkhand, which is not so developed. It's a rural part of India, and I have been living with diabetes since 2019. And I also prior to that, I had experiences with diabetes as my parents, like both mother and father, are living with that. So I have a knowledge of that. But getting diagnosed with diabetes for me was a like challenging movement, like to accept it, because since like it is a lifestyle disease, but still having some disorder with you is a challenging thing. So apart from this, I work as a software engineer, and I am yoga enthusiast, and I practice yoga and try to learn the meditation part of it and try to teach with it. Apart from that, I am a community speaker where I contribute to teach soft skills to children. And yeah, like this is a brief about me. Also, I would like to include, like, if you will not find me in work or these events, so for me, I go to a walk with my Labrador and read books in my free time. Thank you.
You were obviously diagnosed with type 2 diabetes relatively young. Can you tell us about your journey to diagnosis? Why did you end up going to the doctors? And when you eventually got diagnosed, how did that make you feel?
Okay, thank you for that question. So, basically, as my parents were diabetic, so I was conscious about my health condition. I went to regular checkups, like full body checkups. So I just had a checkup 6 months before. So in that, they checked every parameter, but not the HB1AC. So like they checked the blood sugars and other parameters, but not HbA1c. Might it had been checked, I would have diagnosed earlier. But at that point of time, at that point of health checkup, they gave me a like green signal that everything is okay with me. So like I just completed my studies and moved out for a new job in Mumbai. So I like from family to alone, like I lived with my family, but now in a job I have to manage by myself. So and new job was there, so my routine changed, and like I was not aware, like I feel tired, so I thought that it was my job that is lacking my energy. So after 6 months of job time, I went to my home, and my parents seen me, so they said that you are getting weaker, like there is something wrong with you, we have to get you checked. I also felt something I my office was 1.5 kilometer from my residence in my work town. So whenever I went there, it was tiring. Like walking 1.5 kilometer was tiring for me, and also like pushing the doors, lifting something was challenging, and also symptoms like getting thirsty, urinating frequently was there. But I ignored, like due to like what is whatever you say, like new setup of life. I ignored that, but I went to home and it was checkup. So my HB1C was above 15, and like doctor said that you have to get you have to get admitted as soon as possible. So that is the point of time when I first know that I had type 2 diabetes, and it was my 25th birthday, and the date was September 5, 2019. So that time I was 25 years old, and yeah, like while like I had to celebrate my birthday and I was in hospital. So that's why this situation I remember vividly. So this was the my diagnosis story.
Yeah, not a great 25th birthday. Um, uh, your story it's so relevant to all of us in terms of you change something in your life, you move, get a new job. Obviously, you feel tired. It's so easy to just ignore all of those symptoms, like you say, and it's not until um, either something goes very wrong or somebody says, "Are you all right?" That you actually want to go to the doctors and get some sort of diagnosis. Yeah, I think we can all relate to that. Um, so something we do hear quite frequently from people living with type 2 diabetes is that sometimes, because as you sort of intimated earlier, it can be a lifestyle diagnosis, or you can be made to feel that it is a lifestyle diagnosis, and therefore you as the person with the condition is somehow to blame for that condition. Is that sort of shame and stigma post-diagnosis something that you've experienced? And if so, how did people make you feel that way?
Yes, so having a disease in community, like let's say diabetes at a young age. So since my parents were suffering from that, so in my home nothing changed. But they were like that, please don't disclose this to everyone. Like let's say if any person outside of home will know that he's suffering from diabetes, so he will feel pity on me, like how come he got diagnosed at an early age. Also, when I was on hospital, so the doctors were illiterate, so supported them. But the other hospital, like hospital staffs, like nurses, they said that it's heredity, like you got because of heredity. So like they said that it's not your disease, it's heredity thing. So like it was to happen. But yeah, that was the situation. Like yeah, like parents parents initially, like they were like that don't disclose to others. But while time passes, like let's say if I visit to relatives, so they offered me cake, sweets, so I have to eat. So that situation got worse. Like I have not to eat, and going to some houses, they offer the things. So I had to voluntarily tell that I do not take this is because of diabetes. Like in my close relative now everyone knows, but still, like let's say if I go to some person and they offer me cold drink, so I have it because like my sugars are maintained. But that stigma is there in our culture.
Yeah, we do hear that a lot, and it seems to be universal, a global, that people with type 2 diabetes feel somehow responsible, sometimes for bringing it upon themselves. But it's very interesting that you say that your family encouraged you not to tell people about it, which, like you say, is actually very hard when you're trying to manage the condition.
Mm.
Um, so,
Yeah,
talking
also,
about your diagnosis, Deepak, sorry, carry on.
yeah, I will like it, like my friend circle, like people of my age says that you have got a disease which generally have to the older people, like you are a oldie. Like they do a joke like that. But I understand that I understand about their point of view. They said that you are a couch potato, you do not do exercises, that's why you do it. Like with like that sort of mindset is with that. So like I cannot blame that this is the thought process of all the people.
It's not great, is it? But yeah, it's hard to live with, and it's also hard to manage all your relationships and yeah, all the everyone's jokes. Yeah, yeah, well, that you've heard quite a few times. Um, so you have moved a, a few times across India. And I think you have lived in both big cities within India and also out in the countryside in India. Can you tell us a little bit about how the healthcare settings were different in each location? For example, what was the healthcare provision like in the rural settings compared to the cities?
Yes, definitely. So there's a lot of difference. So rural India and the urban India, both are poles apart. Like if we talk about rural India, we have small things like a small setup of the healthcare. Only one doctor, one physician would be there. He will diagnose for all the things, and there will be a medicine, like there will be a limited medicine stock for there. Like only the general medicines and general physician would be there. He will, like one doctor for all the things will be there. So they are, if anyone got diagnosed with special things like diabetes is also of many types, like type 1, type 2, lada. So to differentiate that, they have to refer to patients to the urban centers only. So for disease like diabetes, it's a little complicated at the same time. Like it's a normal disease but very complicated. Like it's depend on the type. So in rural India only they prescribe for medicine, basic medicine also. In rural India, the treatment is based on exercise, diet, and medicine. So yeah, also the like education of the doctors. So one physician treats for all, and in urban setup, like you have the specialist, like the sugar specialist and all for the disease.
So there are huge differences then. And have your diabetes community ever faced issues with medication being out of stock in any of those areas? And how often might that happen?
Basically, in urban setup, if like medicine is not sought, like if one brand is not available, we can go for another brand. Like it will be available with one or other medicine center. But in urban areas, like in rural areas, basically, there is a shortage of insulin. Nowadays, it has improved, but since the in India we have many generic brands, and like things like insulin are available. Earlier, the insulin were not available, also the medicine were not available, and so the like let someone has to take a 100 mg of metamorphin tablet, so he have to take two 500 mg, or like he have to go for the substitute frequently. Not He will not get the prescribed medicine on time. Either he have to go to substitute, or he have to wait for the medicine to arrive at the center, or go and travel to like 400 kilometers, 200 kilometers to get the medicine. So like the diabetes related medicine get sorted, get out of stocks in those area, like so due to some reasons that can be investigated, I think.
And how would people travel those 400 kilometers?
Okay. So
How would they go
basic
about doing that? That seems like an enormous distance for me.
Yeah, so travel they have to manage. Like let's say if your relative is there in any town, so you will call them that please check that if medicine is available at the health center. So they will either buy or courier it, or you have to go at your time by buses or trains to take the medicine. Like especially for medicine, you have to go and take the medicines.
Wow. Gosh. Okay. That's quite a difference then, isn't it? So in India, Deepak, do people have to pay for their prescriptions for type 2 diabetes, or is there some government scheme that helps you?
Yeah, actually, we have some government scheme, but they do not pay for medicines. Like in India, most of the health insurance are there, but they only pay for the inpatient thing. Like if you get admitted to the hospital or getting treatment inside the hospital. But for medicine, like people who are well to do, like who can afford, can buy the medicine of the brands, like whatever the pharmaceuticals brands are there, they buy for that. But the people who cannot afford, like let's say the low income group people, they have to go for something called generic medicine. So let's say the something is available at 200 Indian rupees, so same thing will be available for 10 Indian rupees for generic medicine. So that facility helps the low income group. And for for people who can afford, yeah, they generally go for taking the medicine by their own money.
Okay. And is that the same for all conditions? There's no differences, like some conditions aren't more subsidized than others.
No, no, as by my knowledge, like only the only the disease that are in the national viral control things, like let's say hepatitis, HIV, and some disease that UNESCO has given list like viral diseases. So we like the medicines are only available free for those medicines, like those diseases. Yet for other these type of diseases which are not listed, like not in the national health program, so they do not consider it.
Okay. Thank you for that. So, thinking back to when you were first diagnosed, I mean, obviously, you're slightly different in that you had a lot of knowledge from your family about the condition. But what sort of information did you receive when you were first diagnosed from healthcare practitioners? Did you receive printed materials or sort of website links? How would you have got your information about the condition?
Yeah, so as I was diagnosed in a smaller area, like the remote sort of thing. So I was like I had a knowledge, but from my parents, I only had a knowledge that medicine should be taken on time, diet should be taken control. But when I was admitted, there was a whole lot of tests, like the blood test, HB1C test, and some GAD body test to differentiate if I had type 1 or type 2. So all the sorts of tests were running. I asked doctor why there are so many tests. He did not say, like I had to go to the Google for that,
Ah,
like to check Google, and the Google for like some forums on Facebook where where they discuss about diabetes. So I asked my question. My doctor is doing so much of test. Why they are doing? So I got my questions answered from these forums where the online patient groups were there, where people with the similar experiences were there, and they shared that this test is necessary to distinguish if your body has been not damaged with the diabetes and what type of diabetes is there. So there was vitamin D test also. So they tell me that how vitamin D and diabetes level is related. So basically, I went to Google and the online forums. Like everything anything we know, something happened to us. So we are curious what is happening and what is not happening. So that was thing, like why doctor is running tests for me? What is the significance of those stores? So those are answered by basically with the online community where I was engaged.
and is that normal in your community that people rely on peer knowledge? It sounds like more than information that you get from healthcare practitioners. Is there quite a thriving community in India for type 2 diabetes patients?
Yes, basically we see, like let's say if we go to doctor, so they will only see the your numbers. What is your HbA1c? What is your fasting sugar level? What is your after eating sugar level? So they will prescribe medicine and they will give you a diet chart. So only those information. Apart from that, let's say after eating the according to that diet chart also, we got elevated high sugars. So by engaging with the online patient groups, like let's say my friend is there, he's also suffering from that. So my sugar level is 200, he is also is 200, and he controlled his sugar level. So he share his experience. So by reading that or by knowing that, it get motivated that if he can do it, yes, I can also do it, like I can control my levels. But going to doctors will not only, like they only prescribe medicine and give you diet chart, so following that will is not so motivating. So online patient group, like uh, knowing someone with your sort of experience, like your sort of suffering and healing, gives a boost. And also, if let's say someone is newly diagnosed, as he's not so motivated, so connecting there and explaining there the things, that it's not a great deal. It's like a regular routine. If you will be routine yourself, then you can get over this stride of the diabetes too. Like you can manage it well.
I think you're a member of an advocacy group and a patient network in India, aren't you? How does that work?
So yeah, as I said that when the reports were running, like the doctors were running reports on me, so I get to that forum. So by connecting to that, it is called Blue Circle Diabetes Foundation. And basically I connected it to Facebook, but after that, it has many outreach, like it has a WhatsApp group, and in various cities, it it organizes coffee connects where people meet and
Oh,
share their
wow.
experiences. And like apart from type 2 diabetes, they also teaches people about other form of diabetes like type 1 lada, in like gestational diabetes. And in this coffee connect meetup, we uh, like we talk about the like benefits of continuous glucose monitoring. Another diabetes, like let's say if you are suffering from diabetes, then you have to regularly monitor yourself, regularly monitor your numbers, what HB1AC is what HB1C is less. And also we advocate, like it's a like we advocate for affordable medicine for like non-communicable diseases, like since diabetes is non-communicable diseases, and it's spreading at a faster rate. So these sort of events and workshop we organize. Also we have uh, classes like a webinar kind of thing every Sunday 5 p.m., where people can interact, join the webinar, and get the knowledge about exercises, like new trend in diabetes. So we try to educate the masses and learn from the our experiences in that.
So we've sort of talked about this really, but what do you think makes peer information more useful or as useful to you than your doctor's advice? It's sort of, you've been describing the lived experience and the fact that it's really motivating to hear from other people who know what they're talking about because they've lived it. Would you agree
Yes.
that it's the motivational aspect of your peers that are really interesting to you?
Yes, so as I said, while going to doctor, he will only advise myself. And as like let's say talking about diagnosis of my mother and father. So when my mother was diagnosed, she was also 32 only, like not
Oh.
so old. Yeah. So yeah, like she was also demotivated. So at that sort of point, no, like they were not tech savvy. Like it was around 2008, so we don't have access to smartphones. We have only that basic phone, button phones. So whatever was there with the online like the local community only, and people were not so aware. Like and also like we cannot know that who is having diabetes and whom to reach for the information. So only short of information point was doctors. So go and visit doctor, take medicine, and like she was not aware of regular monitoring. Like let's say
Mm.
doctor will schedule an appointment for 3 months. So she will take the medicine for 3 months, and after 3 months or 4 months, she will visit again. So that was missed due to the lack of peer experience.
Mm,
Now, since we are connected on WhatsApp, Facebook, and this site of workshop, so we know the benefit of monitoring the things and regular checkups and regular monitoring of condition. And yeah, like let's say type 1 diabetes are for children's, like let's say 8-year old also, 4-year old also are suffering. So having those patients in our group, like those patient story, so like for personally me, the in that group, like people with age 3 is also there, people with age 70 is also there. So
mm,
that motivates me, like if he like he is the living example, he is
mm,
overcome, he is having he's fighting it, and he has made 38 year out of diabetes, like he's still he is diabetic, still he made 38 years and done a great lot of life.
mm,
So
mm, mm,
yeah, that is motivating.
mm, mm. Absolutely. Yeah.
So
No.
basically it connects the dots between the whatever the doctor's information is missing and
Yeah.
whatever
Yeah.
we get from the peers. So
Yeah.
that dot gets connected with the peer experience. So that is learning for us.
Yeah. No, that's really interesting that you're just sort of describing a real like holistic environment, really. So you've got quite a lot of information coming from the doctors, but you've also got information from people who have been living with the condition for years, giving their own experience as well. Sounds like a great community. So we are nearly at the end of our conversation now, Deepak. Just so that we finish on a high, I've got one or two really big questions to ask you. So, the first one is, if you could change just one thing about how healthcare is delivered in your community, what would it be?
So like let's say the benefit of regular exam, like in our community the regular health checkups are not there. Someone will only get health checkup if he gets something, like he gets some illness. So regular checkups and inclusion of holistic things like exercises, yoga, and other stress management things uh, in the daily life of children. So our government is doing on that of including holistic things, but the regular checkups things yet to be included. So the regular checkups of everyone, irrespective of he's getting ill or not, is the biggest thing that I want to include.
So prevention rather than can't think of what the word is, but
Yes,
prevention more than treatment, I guess.
cure. Yeah,
Yep.
prevention
No.
is better than cure, as it said. Yes.
And if you could, what would make you feel more seen, heard, and respected as a patient? What one thing could the healthcare professionals do to make you feel more seen and heard?
Yeah, so basically what happens whenever we go to doctors, so some doctors think that they are knowledgeable and do not allow patients to listen up. So they should listen up that like I am the patient, I am the taking the medicine, I am following their advice. So what affects is they like a doctor should hear the patient and then he should prescribe, not the other way like that he will prescribe everything and like so basically whatever he's prescribed, if it is working or not, he should acknowledge that. And apart from that, so that being heard, seeing the treatment from my patient's point of view is one thing. And yeah, like let's say if I change if initial days I was in insulin, so I asked doctor to remove insulin, so he did not inform me about why insulin is prescribed, why it is not. Now I know that if your blood like HB1C is more than 10, then insulins are important to lower the risk. So answering the why of the patients, so that is also important.
Yeah, thank you. So you're really describing again a real sort of um, holistic approach. So a sort of an all-round approach, just like you have in your patient communities. So you're sort of treated as a whole person, not just a series of numbers on a sheet. So
Yes.
Deepak, thank you. It's been really, really interesting talking to you and hearing from um, a continent that we don't hear from very much in the pharmaceutical industry. So thank you so much for sharing your experiences and being so open and honest with them. Is there anything that we haven't covered that you want to share? Because now is your chance.
Basically, we covered ourselves, but like talking basically to diabetes, we have a whole lot of diabetes, like type 2, gestational, LADA, and also type 3.5. Basically, it's emerging. So, health professionals should diagnose on basis of that. And apart from that, on my personal thing, apart from diabetes, I had an heart surgery earlier, and like it was a childhood disease called atrial septal defect. So that all, like the having experience with these condition have made me strong, not weak. So that I wanted to add. Yeah, thank you.
I think that's a really powerful message to end on, Deepak. So thank you for sharing that. So having all these experiences has made you strong, not weak. So please, take that away with you.
Yes,
Thank you so much for taking the time to talk to us. We really appreciate it. And it's been really interesting and fascinating speaking with you as always. Thank you.
thank you.